What if your daily habits are secretly putting your life at risk? You might enjoy a glass of wine with dinner or grab a cold beer after work, but have you ever considered how these seemingly harmless choices could affect your health? When it comes to cancer, knowledge is power. In this lecture, we'll explore the connection between alcohol consumption and esophageal cancer, a type of cancer that can develop silently and strike when you least expect it. Understanding the factors that contribute to this serious condition can empower you to make informed choices about your health and well-being. What is esophageal cancer? Esophageal cancer begins in the esophagus, the muscular tube that connects your throat to your stomach. Imagine this tube as a highway for food, allowing it to travel smoothly from your mouth to your stomach. When cancer develops, it disrupts this crucial pathway. Esophageal cancer can be particularly aggressive and often goes unnoticed until it has reached advanced stages. There are two primary types of esophageal cancer. 1. Squamous cell carcinoma. This type starts in the squamous cells lining the esophagus and is most commonly found in the upper and middle sections. 2. Adenocarcinoma. This type originates in the glandular cells that produce mucus and is typically found in the lower section of the esophagus, closer to the stomach. Both types begin in the inner lining of the esophagus and can spread to other layers, making early detection essential. Alcohol and its impact on your health. Alcohol is a chemical found in beverages like wine, beer, and spirits. When you drink, your liver metabolizes alcohol with the help of an enzyme called alcohol dehydrogenase. This process breaks down alcohol into a substance known as acetaldehyde. Why should you care about acetaldehyde? Because this compound is a double-edged sword. While your body works to process it, acetaldehyde can cause irreversible damage to your DNA. This damage can pave the way for cancer development, including esophageal cancer. The statistics are sobering. Alcohol is responsible for about 6% of all cancers and 4% of cancer deaths in the United States. If you consume 1 or 2 drinks a day, your risk of developing esophageal cancer increases by 1.3 times. For those who indulge in 4 or more drinks daily, that risk skyrockets to 5 times higher. Other risk factors for esophageal cancer. While alcohol consumption is a significant risk factor, several other elements can contribute to the development of esophageal cancer. Here's a closer look. Age. The older you are, the greater your risk. More than 85% of esophageal cancer diagnoses occur in individuals over 55. Gender. Males are at a higher risk than females for developing esophageal cancer. Tobacco use. Smoking or using tobacco products, like cigars, and chewing tobacco, significantly increases your risk for both types of esophageal cancer. Diet. Diets rich in processed meats may elevate your risk, highlighting the importance of nutrition in cancer prevention. Obesity. Being overweight raises the risk of gastroesophageal reflux disease, GERD, which can lead to adenocarcinoma. Additionally, certain medical conditions can also heighten your risk. Barrett's esophagus. This condition arises from chronic acid reflux, leading to changes in the cells lining the esophagus that may develop into cancer. Plummer-Vinson syndrome. This syndrome is characterized by webs in the esophagus, and approximately 1 in 10 individuals with it may develop esophageal squamous cell cancer. Achalasia. This swallowing disorder hinders food movement, irritating the esophagus and increasing cancer risk. HPV infection. Some studies show a correlation between HPV infection and esophageal cancer, particularly in certain regions of the world. Other cancers. Individuals with other cancers, such as mouth or throat cancers, face a higher risk of esophageal cancer. Symptoms. When to seek help. Esophageal cancer can be insidious. Symptoms often don't appear until the disease has progressed, making awareness crucial. Common signs may include difficulty swallowing, dysphagia, persistent heartburn or indigestion, unexplained weight loss, coughing or hoarseness. However, it's essential to remember that these symptoms can be attributed to less severe conditions. If you're experiencing any of these signs, consult a healthcare professional for an accurate diagnosis. Early detection is vital and can significantly improve outcomes. Prognosis and survival rates. The outlook for esophageal cancer largely depends on the stage at which it is diagnosed. The overall 5-year survival rate is around 20%, but this varies widely depending on how advanced the cancer is when detected. Early stage diagnosis significantly increases survival rates, with treatments more likely to be effective. If left unchecked, esophageal cancer can quickly spread, complicating treatment options and reducing survival chances. Prevention: take charge of your health. While not all esophageal cancer cases are preventable, there are proactive steps you can take to reduce your risk. 1. Avoid smoking and excessive drinking. Reducing or eliminating these habits is one of the most effective ways to lower your cancer risk. 2. Eat a nutritious diet. Focus on a diet rich in fruits and vegetables, which can provide essential nutrients and antioxidants to help protect your cells. 3. Maintain a healthy weight. Regular exercise and a balanced diet can help manage your weight and reduce the risk of GERD. 4. Consult your doctor. If you have symptoms like chronic heartburn or difficulty swallowing, don't hesitate to seek medical advice. Regular checkups can catch potential issues early. Conclusion: empower yourself with knowledge. Esophageal cancer is a serious health concern, but understanding the risk factors and taking proactive steps can empower you to make informed choices. Alcohol consumption is a significant risk factor, but it's not the only one. By considering other factors such as age, gender, tobacco use, diet, and underlying medical conditions, you can take a holistic approach to your health. Don't wait for symptoms to appear. Be proactive about your health. Consult your healthcare provider, adopt a healthier lifestyle, and educate those around you about the risks associated with alcohol consumption and esophageal cancer. Remember, awareness is the first step toward prevention. Stay informed, stay healthy, and take charge of your well-being.